off, and people may still join as we go along. So I'm Paula, Chair of ISA. A warm welcome to everybody. We're trying sort of different times for ISA Present. So this is the sort of the Europe evening slot. And it'd be great to get some feedback from you, actually, what sort of times work best for you guys. To try, we try and alternate sometimes so that we get as much participation as possible. So anyway, I'm going to hand directly over to Kerry, who is going to talk us through her work with fathers. And we were very lucky to hear about this in Colombo recently at the conference. So Kerry's agreed to do a presentation for the wider membership for whoever missed the conference in Colombo. So Kerry, over to you. Just introduce yourself and off you go. Thank you.
Thank you so much. So I'm Kerry Jones. I'm a senior lecturer in end-of-life care at the Open University in the UK. So I'm really pleased to be able to kind of present this, some of the research that we've been doing with fathers' experiences of perinatal loss with a group, because they do fantastic work. So thank you for inviting me. So this evening I'm going to be talking about this evening UK time, about research that we've been conducting with fathers' experiences of perinatal loss through the way that they receive support through Sands United football teams. So to kind of set it into context, one of the reasons that we were really interested in exploring fathers' research is that we not only noted from the literature that it's kind of increased in sort of quite substantially in recent years. And I know Joanna O'Leary is here, and I can remember reading a lot about your work, Joanne, particularly around fathers, and I thought, oh, great, somebody is doing something. And more recently, having conversations with Australian colleagues about some of the work that they're doing, because they've been really interested in this type of work around miscarriage as well, in particular. But the point that we've come to is that we know there's been quite a lot of research around mothers, for lots of reasons, and quite rightly so. But there's a lot less known about fathers' experiences because of the roles they tend to kind of undertake, maybe being kind of like the supportive partner, etc. And from previous research that we've undertaken over the years, kind of separately in terms of myself and Sam, and then as we've kind of come together with Martin as well, is that we know that fathers are less likely to access kind of support, particularly conventional supports of those, particularly that are available in the UK. Maybe it's through the NHS kind of form of support, or even those that are supplied by organisations, or even those that are set up specifically to support bereaved parents, such as Sands. That the kind of idea maybe of going to a face-to-face group, a mutual self support group, is a complete big no-no for some fathers, and they find it incredibly daunting to kind of open up about their kind of experiences. And when we've spoken with fathers before in our research, where we've interviewed them together, so we focus on the mothers and the fathers as kind of either dyads or kind of separately in focus groups, there's been a lot around the kind of social and cultural expectations which they feel they have to live up to about being quite stoical, about being the kind of supportive father, even though internally that they could be falling apart. And while their partners, the mums, might be maybe talking about it, not all of them, but maybe going to support groups, etc., or trying to find other mums who've been going through quite similar experiences, they might be finding themselves, taking out how they're feeling on, hacking down sort of limbs from the tree, etc. As kind of one quote that's kind of come to me back from kind of past research. There's certain expectations that they felt that they've had to live up to. Now, since I'm talking about specifically about the research that we've been doing with Sands United football teams, just to kind of set it into context, a lot of you are going to know about what Sands represents, but just to kind of give a bit more of a flavour, is that in the UK, they are one of the leading kind of stillbirth and neonatal death charities that were set up in the late 1970s. And they were there to provide support to campaign and lobby parliaments, to raise awareness about the fact that it does happen in high-income countries. And that, our rates aren't particularly good compared to, other high-income countries. But as well as providing support, I mean, I know when I was first kind of looked into Sands and what they did, they were providing the kind of telephone support and the kind of focus groups, and they've since expanded into forums and kind of online communities and so forth. But the other thing they do, which I think is important, because when we think of particularly around care in hospitals and so on and so forth, is the kind of memories that live on with parents is what is said to them or the way that they've been supported. And sometimes professionals aren't always equipped for whatever reason to say the things that parents want them to hear. And so what SANS do is provide training and also provide resources for professionals, whether it's leaflets or kind of like brief kind of guidelines, but also the kind of bigger guidelines, the national guidelines, which they update now and again. So in turning to the Sands United football teams in particular, now this was first set up by Robert Allen, who you can see here in the kind of picture frame with his wife following the death of his daughter Neem. And the aim was to provide a kind of supportive network that kind of started off quite small locally, but really to give fathers that kind of space and location where they could feel, I guess, at one with other fathers who've gone through similar experiences, that idea that you can look at somebody, across the field or, in the bar afterwards having a coffee or a pint, etc., and know that somebody else has gone through a similar experience. And it's been quite a unique way to provide that kind of support and that community to fathers and uncles and grandfathers, I might add, to those affected by sort of this form of loss, and through a shared love of sport. Now, I will add that a lot of the fathers that we've spoken to aren't necessarily good at sport. They lose quite dramatically when they do kind of play, and they're quite jovial about it. But for them, it's the kind of medium of that kind of physical activity, that medium of football, which is quite rooted in the kind of national consciousness of within the UK. It's one of those conversations that a lot of people like talking about in certain venues. And so this provided a medium for these fathers to kind of come together and to maybe think about, share, talk about however that happened. And I'll go on to explain about that in a bit more detail as I progress through the slides when they're ready. And even when I was first beginning to explore this, and I was talking to some of the fathers that they wanted to join a SANS team, but it was an hour away, and by the time it came to kind of interview them, there was one locally. So it really has proliferated quite significantly and grown in popularity. And there is a link on the bottom there where Rob Allen is talking about why he set up the kind of Sands United football team in his local area. And one thing with the kind of proliferation with the football teams, it has garnered media attention. A lot of the fathers have spoken about the value of the teams in kind of the tabloid press. They've gone on to talk on radio about it. There's been programs developed about it, lots of YouTubes. But one thing that we haven't really known today is kind of like a bit of a kind of in-depth exploration about, okay, what is it that really draws people to the fathers to the team? What do they get out of it? And kind of a bit what goes on within those teams when they meet on a Wednesday night, for example, or Thursday night for training, for drills, and when they have those charter matches on the weekend. So the study itself was kind of like a research team, which is a kind of fusion of a lot of our interests. So myself and Sam are kind of bereaved parents ourselves through stillbirth and neonatal death. And we've always been kind of keen to research. We both did our PhDs around this area where we interviewed both mothers and fathers. And Martin Robb, who's a wonderful colleague of ours, who's done a lot of work around fatherhood and masculinities and how people kind of live up to those kind of expectations and through conversation. So we really need to get together and kind of explore this. And pre-COVID, because I know we talk a lot about pre-COVID and kind of post-COVID and what happened in between. We did have a meeting with Sands, so we really want to kind of get back out there and talk to bereaved parents about some of the support that's around for them at the moment. And of course, this kind of all proliferated through COVID. So we thought we need to go ahead. We don't want this to kind of stop us. So we decided to kind of run interviews online, and we had a great colleague in our Open University office in Cardiff, who himself was a bereaved father, who had set up a local team as well. And he was able to have the information from us about the study and say, if you're interested, get in touch with the research team. And so that kind of snowballed through the rest of kind of the football teams in the UK. And with any endeavour, we wanted to kind of interview as many as we could. And we know that we reach a saturation point, but what we had in the end was a kind of a bit of a magic number, if you like, which was 11 members, which is the kind of football team number of fathers that we were able to interview. And just to give some kind of small demographic information, the men that were interviewed came to us with a kind of average age between, or they were aged between 34 and 45 years of age. And some of them were coming to the interviews where they might have had a loss a year previously, 2 years, 5 years, and 10 years, which also said to us something about the fact that there might not have been support for them prior, but the fact that it was happening in 2017 onwards, so really quite recently, really kind of attracted them to the group. And so I've said the kind of interviews were kind of conducted online. And what was interesting with the interviews, that even though they weren't able to kind of meet face to face, to have the training and do the matches because of all the kind of COVID restrictions, they were still able to make the most of the other support systems which they had in place, which I will kind of go on to talk to. So that was kind of really important for them. So it still had a significant value in terms of belonging to those teams. So the kind of interview questions topics, when exploring something around bereavement, we wanted to kind of leave it fairly open-ended, but obviously kind of quite focused on Sands United football teams. But we wanted to know what prompted them to, join the team. Was it due to kind of lack of access in, gaining support, or they didn't want to kind of by more conventional means? And we also wanted to ask them, how could the kind of the support be improved kind of more generally and through the kind of Sands United football teams? So from those interviews and from the kind of thematic analysis that we undertook, we had some key findings which were based around accessing support, what it meant to be part of a community of shared loss. We've often heard, and I know we have in this space that we're in tonight, that often people talk about it's not a group that necessarily we want to belong to or people want to belong to, but once they're there, it's not necessarily one they really want to leave because of the support that they get and that opportunity to talk, which kind of leads me on to the next finding, which is that the teams facilitated that space and that location to talk, which is not often found in other spaces, whether it's in those familial dialogues, whether it's dialogues with friends, even with best friends, that point where fathers returning to work, sometimes with those awkward silences, or when somebody offers a really quite sensitive sentiment, but fathers don't know how to kind of respond to that. there's something about the Sands United football teams where the activity just facilitates openness, but in lots of different ways, whether it's coming together, whether it's having a pint afterwards, whether it's going to the social events, which I learnt they do now, such as the barbecues, and they involve their families, or through memorialization, which is, key to a lot of parents and to these fathers, and also the kind of that altruistic kind of tendency that the fathers had, which was that they'd been there for some time, and that kind of sense of belonging meant that they wanted to kind of give something back. So I'll go into a bit more depth in terms of the kind of the themes, which I'll come to the first one, which is about accessing support. So a lot of the dads spoke about, when they were learning that, something was wrong, whether it was before the baby was born or during the labor, or, when the actual death happened, um, a lot of them spoke about they didn't feel that there was nothing. Sometimes they would be handed, a leaflet, maybe from, the staff that were trying to support them at the time in hospital or shortly after in the community. And sometimes it'd be a Sands leaflet about some of the support that they offered. Um, and they didn't feel that they necessarily wanted to access that at the time. And so, as a lot of us do when we're confronted with what kind of life gives us, whether it's bereavement, whether it's death, whether it's certain diagnosis, we kind of turn to the web. And this was no different for these fathers as well. They were trying to find others who'd gone through similar experiences, and whether they went to kind of forums, there might be the odd dad that was posting something there, but because it tended to be visited maybe by mums, often fathers felt that they would be kind of left hanging there, and observing that and witnessing that obviously kind of put fathers off. So they were seeking support. It wasn't that they didn't want it. They were just trying to find the right support. And one father kind of quite eloquently said that, there is that kind of thing of giving empathy towards the mum, and kind of quite, excuse me, quite rightly so. Um, but there's that thing around the kind of discourses available to us about what we're supposed to do in certain situations and the roles we're supposed to take on, and 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 when it's okay to be expressive and when it's not okay to be expressive, and who takes that role on. And I know that even amongst mums who might have been expressing grieving openly in public, and they might have met somebody maybe walking down the street and they're very tearful, and somebody's saying, "Oh, for goodness sake," and that, and they are met with those sentiments. We know that, through the kind of work that we do. So there are those kind of certain expectations, whether it's the timing, the role that you undertake, who you are, and the expectations that surround you are kind of mediated by so many things. And so in turning to that kind of community that the belonging to the kind of football teams means, is that it was the only opportunity sometimes that they had um, to kind of share. And as I've alluded to already, it's a community they don't necessarily want to join, but when they're there, they're kind of buoyed up in different ways. There's kind of WhatsApp groups that they can access. So if they don't want to talk, or they're having a bad day, they don't want to share, they might reach out by the WhatsApp groups and saying, I'm having a bad day, or they can learn something about somebody else's experience, whether it's putting a headstone up, because who knows how to do that when you're not expecting your kind of baby to die. And a lot of fathers spoke with the kind of sense of pride about being able to kind of go on with the football shirt, which has their baby's name, and go out onto the pitch. And as one sort of father says, we can't play with them, but we can play for them. And so there's a lot of pride in sort of going out there and running about and trying to score a goal, and always keeping in mind and in their hearts that they're actually doing it for the child who is not present but very firmly internalized within themselves. And again, there is that kind of spirit and there's that camaraderie, getting together in the changing room. A lot of the kind of Premier League football teams in the UK have lent their kind of changing rooms to the Sands United football teams, and they've allowed them to put a plaque in there, and so that kind of really adds to that kind of sense of community. They've got their own changing room. They have their kind of pep talks in there, and say, we're going to go out there and we're going to make our kind of babies proud, and they're all in on that. Yeah, they're all in on that kind of that aim and that goal and that permission just to be able to kind of do that. So again, it's that kind of that arena, if you like, to kind of that space and location talk. So, they'll have the training, their drills, they'll have the kind of conversations where, even on the charity matches, they're waiting for somebody to kind of go on. They'll meet afterwards, they'll meet socially, and they'll have those conversations. Um, and it's even when, men return to work, as they have to for all sorts of reasons, financial reasons and parental leave reasons. They're having to go back to work, or they're having conversations with best friends that they've known for many, many years, from school days, etc., from college days, or from early days in the workplace. And they're not able to kind of have those conversations with those kind of people that they and those networks that they ordinarily relate to, because things have changed so much since what they knew before their baby died, and the discourse that was available to them, that for some fathers it was almost Dickensian that a baby died, and they hadn't necessarily been that aware of stillbirth and neonatal death to the point that they've reached. They very much do now, and it's kind of happened to them. And again, that kind of space and location, that if they're having a bad day, it doesn't have to be verbalized there and then. They're kind of like WhatsApp groups, and to kind of get that kind of support. And there's something about that activity kind of facilitates openness, that I've talked about, that you could be engaging in your drills. It's quite physical, but then you might go for kind of like a pint afterwards. And, in those kind of locations, you'll have your round tables and people are sitting around them. So sometimes it could be 2 of you, 3 of you, or 8 of you. And so you can have quite intimate and in-depth kind of conversations when somebody begins to open up and somebody kind of responds to that. And those groups are not kind of strict in terms of membership. People come and go, they get what they need out of it, but it's kind of that medium by which they begin to kind of open up. Um, and one thing that the fathers also spoke about is that sometimes, in any kind of setting, whether they're in a meeting or we're in a group, whatever group that is, sometimes some people talk more than others. And, this father, the last quote, was talking about the fact that, he noticed this dad who maybe was kind of standing on his own a bit to the side. But when he was able to share on the WhatsApp group what had happened, the other fathers began to realize what was going on with this kind of particular father as well, and were able to kind of respond to him in the WhatsApp, and then begin to open up those kind of conversations, maybe outside of those drills as well. Now, memorialization, you probably won't be surprised to hear that this was a huge deal for these fathers, even in this kind of small qualitative study, because even with this research and research that we've conducted before, and very in-depth interviews, sometimes they've lasted, sometimes for hours, and you've been in people's homes and you've been listening to kind of both parents' stories, is that it's that being able to say the baby's name. and talk about the baby, what they looked like, who they resembled, what they were dressed in after they washed their baby, if that's what they did, the mementos they kept, and all those kind of early stories which lend a personification to the baby who has died. And sometimes with people who are outside have might not have met, something's happened very kind of quickly, such as a stillbirth, compared to a neonatal death where there might be kind of family who come to visit, or sort of friends. And it was about kind of, in a way, demonstrating that the baby is still part of that family's biography. They were a baby that was real and existed in some shape and some form, but were firmly entrenched in that kind of family's history. Um, and some fathers, did talk about, they do have some friends who mentioned the baby's name, but others don't want to. But there's something about being able to kind of don the kits, and have the baby's name. And when you score a goal, you're able to kind of run up to the stands, and as footballers do, they normally like push out the number on their shirt, don't they, and go this to the crowd, and they're able to do that with their baby's names. Um, and it's just kind of like one of those feelings that they can remember and take away with them. But also quite poignantly, there are days, as with the mums, for Father's Day, it can be quite a strange place to occupy. So when they have those matches on those days, it is a space for the dads to get together. Um, but also to have that minute silence and to choose between them a way to kind of honor that, to remember everybody's babies who is in that kind of match on that day, and to really lend that kind of sense of honor, if you like, to that space, which is so important to these fathers. And we know that when you have memorial services, that previous research, that's really important to parents as well. And so, in terms of belonging to give back, so that there was a level of altruism that was expressed by fathers, that they had joined the group. They might have, sorry, not the group, the teams. They might have been there for some time. They might have experienced their loss some time ago, and this was the first time they were able to kind of think, yeah, I really belong somewhere. Other guys are going through it. I'm able to kind of talk about it or share my experience, or maybe say, this is what you do with a headstone, or when somebody says this is what I do, I walk away, or I might say something, or what have you. And there was that sense of being able to be there, to have somebody else's back in whatever shape or form that kind of took, or even that level of understanding, which is so key. But also through the kind of WhatsApp group, that they would have a WhatsApp group where they would detail the kind of matches that were coming up, the training days, any changes in time, the kind of administrative type of thing. And then a WhatsApp to a bit like a banter saying, oh, well, we lost again, to the kind of because sometimes they'll have former pros playing as well, who still obviously got the kind of skills apparently, and so they'll lose to them, but they don't really care, and they'll have a banter WhatsApp, and then there's a more serious WhatsApp where there are those exchanges where somebody can say, I don't know what I'm doing. This is what I'm thinking about. I'm struggling with this, and they're responded to literally within a couple of minutes. So there's all sorts of ways in which this kind of community has grown to kind of lend that kind of support. And for those men to get a sense of, this is what, I'm contributing through my own experiences. And we know that some parents like to go off and run marathons to raise money, to raise awareness for certain organizations that support bereaved parents, whether it's, developing a memorial garden and so on and so forth. So for these teams, that was their way of doing it. So to kind of the key messages um, through undertaking these kind of in-depth interviews with fathers was that what they were telling us and what they were talking about and what the football teams meant to us was that it really did kind of contradict those stereotypical image that fathers don't want support or fathers don't cry. They might be unable to in certain circumstances and certain situations, but actually they want to express, they want to share in the way that they want to when they're ready to, but that they feel too, and they want that acknowledged. Um, and the way that they access support is not necessarily a good fit for them, that might be available to other partners, etc. And sometimes football is the medium. And I'll acknowledge here today, not everybody's into football or that kind of level of physical activity. There's other mediums that can be explored, but can be the starting point or the way in which to kind of bring a community together. As I just alluded to, that there is that altruistic need amongst some men to kind of give something back. And again, even through the football teams, such as Rob Allen, he wants to kind of create a YouTube or kind of work on programs where they were talking about men's mental health and to say to fathers who might be watching, there is this kind of football team for bereaved fathers who've experienced, perinatal loss. And some men have gone on radio talk shows to raise that awareness and to say it's okay to feel the way that you do. It's awful, but we feel the way that we do because it's important and because what happened matters and it's devastating. And to kind of share that, and they've done that through belong to the football team and saying that it's there for other people too. And so, the men are willing and able to talk openly again when they're ready. But the one thing that kind of stood out as well is that they really want that explicit acknowledgement that, they've had that experience. They've had the experience of a baby who has died, the baby is, the memory of their baby is internalized. They want to kind of continue that bond for however long they want to kind of continue that bond, whether it's years, whether it's for a lifetime for a lot of these fathers. So those are the kind of key messages that we kind of reflected on when we kind of analysed the data from those kind of interviews. And the football teams, they do have kind of parallels with kind of other initiatives which supports men's mental health and well-being in the UK. Whether, so one I've got here, which is about the Redcar football team, which has kind of developed kind of, to explore kind of mental health problems to support those experiencing, loss as a result of suicide. And there's also an arts-based organisation that's run by somebody who is a psychotherapist themselves, running an organisation called All Right Mate, and facilitating lots of arts-based projects, whether it's in the form of exhibitions, such as artworks or narrative kind of path accounts, which are kind of displayed to the public, but which have involved those fathers who are experiencing mental health issues for all sorts of reasons. So what's next? We've always been passionate about this work. We want to continue this work. And through the Open University, which has an Open Societal Challenges initiative, which answers to those interested in climate change, diversity and inequality, and health and well-being, which our kind of project sits under the remit of, we've been able to kind of apply for and demonstrate ways in which we want to kind of take it forward so that it supports us in a kind of future bid. We've just done one recently. We weren't successful. We got favourable reviews. That's not going to be any new news to anybody. We're all trying to do this, but what we will be doing in the kind of very kind of short to immediate term is that we're going to be running focus groups with arts kind of based approaches where we're going to try and utilize photo elicitation to explore fathers' experience of the kind of immediate support that they received, whether it's in hospital or in the kind of community when they've come home. And this will be used to inform a theatre forum. So we're working with a theatre production company who will meet up with and will explore ways in which the data from these focus groups, which are about fathers' experiences of the support and care, can be utilised into play segments which relay those experiences anonymously through a forum theatre, which will involve attendees from, who are midwives, student midwives, birth supporters, clinician, bereavement counsellors, volunteers, etc., to kind of co-produce solutions, if you like. So they get to kind of observe and see those experiences acted out, and they kind of get invited to be involved, even to the point if somebody, for example, is a midwife and they've been trying to support somebody who's experienced, or a family's experienced perinatal loss, and they're being dragged in all sorts of directions. It's about finding kind of solutions when people want to support but they can't for other reasons. But obviously what's received is somebody who might not be interested by a bereaved parent. So it's about trying to support those who are giving support to then support bereaved parents, but coming up with that kind of knowledge exchange and kind of coming together to think about, okay, what is a way that we can think of doing something in a different way that's kind of more supportive, and obviously to kind of raise awareness, but to really give that kind of sense of not always doing kind of research for research sake because we're necessarily passionate about it, but really kind of try and kind of facilitate a change as well. So that's something that we're quite busy with doing next, which we're very excited about. But just I've got a couple of more slides, but I do want to kind of acknowledge the fathers who've shared their experiences through this particular piece of research, and some of the fathers we've worked with since who produced a couple of podcasts with us around their experiences of belonging to a Sands United football team, but also about their experiences of loss, which we're also thankful for. But to all the fathers that we've and the parents that we've interviewed over the years. And so in terms of the podcast, I do want to give a shout out to Stephen Doran and Nick Lang for sharing their experiences, because they did so to raise awareness, to share their stories, and they did so, and they really wanted us to kind of share it as widely as possible too. And so the podcasts are there available. So like I said about the teams and fathers' experiences. So you're welcome to a copy of this this PowerPoint, and one of the write-ups that we did on the research findings of the Sands United football teams is actually contained within a chapter of a book that was edited by myself and Martin Robb, who, as you know, is one of the research team, where we collected men's experiences of grief and loss generally. We wanted to explore the kind of across all types of bereavement, whatever point in the life course it happened. And so there's a chapter available in there. So I will end there and just say thank you very, very much for this space, being able to talk about the research, and for listening. Thank you very much.
Oh, thank you, Kerry. That was amazing. And I did hear a lot of it already in Colombo, and it's just fantastic to hear it all again. And I could listen to it a lot longer and a lot more. It was super, super interesting and really detailed, and I think gives fantastic impression of the work that you're doing. Absolutely fantastic. We do have a few member organizations who work with fathers, particularly. I'm sure you know that because you've probably met them all in Colombo and other
As
conferences.
Daniel,
Yeah, exactly. And Daniel, who we missed in Colombo this year. Um, but yes, so if anybody we are recording this, but if anybody's happy to turn their video on, please do, and we'll have a little bit of a discussion. Um, I think there were a few little comments in the chat box, but does anybody have any questions for Kerry or any comments, or would, yeah, like to share some of their own experiences, anything at all. It's completely open to everyone, and do just feel free to unmute yourself and shout or wave or put your hand up, whatever. And thanks, Kerry. It's so fascinating.
Oh, thank you.
Hi, Kerry. It's Daniel here. Well done. Lovely to. Sorry not to get to Colombo and to hear your presentation live, but thank you so much for your research and for your work. And I can just simply, from the people I've cared for and some of the research we've done with men following miscarriage, I could just say yes, yes, yes to everything you're saying. So thank you for bringing their voices to us, and actually as we bring their voices out more into the public domain, that's actually also providing better care for their partners and remembering their babies. So um, uh, bringing the men's voice to this will actually help us to take better care of everybody who is connected with every baby who dies. So thank you for that.
Thank you, Daniel. And you do amazing work. Thank you.
Thank you.
I don't know if you can hear me.
We can hear you fine, Rosa. Go ahead.
Hi. This is Rosa Caparici. I'm a psychotherapist in frigid Arctic Canada. I'm calling in from Montreal. I was hearing the earlier conversation about Italy, Liguria, and the beautiful weather there. It's about minus 20 Celsius here today. So, and I'm standing outside. Beautiful sunny day, but it's cold. I just wanted to thank you for the presentation, of course, and you know, in terms of a national sport here in Canada, it would probably be hockey. And I could already think of a name, Hockey for Healing. But I'm just curious. Can you tell me how long it took to organize everything? Because it sounds like there are many component parts, and to get that off the ground, how laborious was that?
Yeah, that's a really good question. Thank you. It started off with initial conversations with Sands around Sands United. But then I think as a research team, because we got together, it was about kind of making those key links about who is involved. So when you're talking about Hockey for Healing, for me, it would be literally about approaching them very directly and having those kind of conversations about, you know, about maybe kind of facilitating ways to kind of support kind of mental health, and then opening up those kind of conversations around, or the fact that, you know, perinatal loss is quite a hidden thing. Not everybody is aware or really talks about it. So it was beginning to kind of open up those conversations and having like-minded people in your research team, because one thing when you're researching it by yourself, it's a really it's a hard and it's a difficult slog, a slog well worth doing, I might add. But when you've got, you know, the team with you and that's driving that with you, they can take on different aspects for you. So you're not doing it all, because when you've got other stuff, which is your day job, you know, you're living, and you're kind of psychotherapist as well. And you know, the things like I do here at the OU, you kind of need that. You need that kind of backup. And so that has been my approach that I've kind of learned over the years, is that you do kind of need that, and quite a big voice as well. And actually, sometimes it's also about having that evidence about why it's needing. So, you know, in the context of perinatal loss, we know that there's X amount of families that are affected. That's going to include dads. We know what some of the consequences are, whether it's physical, whether it's kind of the kind of mental manifestation that kind of presents itself in terms of loss. And sometimes it's about presenting that, particularly if some organizations aren't aware. But I would definitely have those conversations. Definitely.
Thank you so much.
And I'm more than happy to have a conversation as well.
Wonderful. Thank you. I appreciate it.
Hello, can you hear me?
Yes, Lucasa, go ahead. We can hear you fine.
All right. So thank you very much, Kerry, for just the information and the presentation. I'm calling in from Kenya. It's a few minutes to midnight, as I'm seeing some of you are in daylight. I had to set an alarm for this meeting before I go to bed, and I think it's really been worth the time. I am with the Tears Foundation Kenya chapter. I'm a peer companion working with the dads division. We actually didn't have a dads division. It has always been mothers, and I think I was the first dad who joined 2 years ago after losing my son, and I just knew that I needed help. And I really could relate a lot to your presentations, to almost everything that you just said from a dad's perspective. Now, my question, or rather an ask, is I'm actually writing a book for dads in the African perspective, because we've realized that actually dads don't know where to start. There are so many marriages that are falling. There are so many dads who are going into depression and suicidal thoughts, and they don't know where to start. And I'm actually trying to help create materials to help these dads to at least find a guide. Because one of the things that we've learned with loss is there's no linear pattern. It is almost as zigzag as any. There's no start, there's no end, there's no better way, but there's a way you can support. So my ask is there a way you could send me materials that I could help to outsource this information, because I plan to sit down with the dads that we worked with in the past year and just interview them and get to extract. I already have a direction on that, and I already have like an overview and overlay. I just thought maybe because you've already done a bit of research, you could help me and make the work a bit easier. If you could, whatever material you could send me, I'll really, really appreciate. I plan to write the book in this whole year. By September, I plan for it to be out. Thank you very much.
Fabulous. Yeah, more than happy to do what I can. On that note, shall I type I don't know how this works. So I type my email, or Lucas, do you want to type your email in? And I'll make sure I have a note.
Whichever works. Let me just tag mine.
Yeah, you can put it in the chat, either of you. And Kerry, if you're happy, we can send your email out with the presentation if you're okay with that, and people can contact you directly. That's fantastic. And there's Lucas's email. Great. Thanks, Lucas. And what a great work, Lucas. That's amazing. I'm so happy to hear about it. Because we did an initiative a few years ago called the Parents' Voice Initiative, and we had a young lady who worked with us to find out what kind of support organizations there were across the world. And of course, the majority were found in high-income countries with the lowest burden of stillbirth, and hardly anything was found in the highest burden context, so across Africa, Asia, where many stillbirths occur. It's really one of our missions, our real aims, and I hope to start something small this year, is to start working with some of these support groups, or individuals sometimes only, in countries which are higher burden, and there aren't very many organizations, because I think there's a huge demand for resources, as you've just said, Lucasa. So that's really on our agenda this year. So we would love to work with you and people like you, Kerry, and Francine, one of our board members in Canada, who does a lot of work. It's in French, but I think she has some materials in English as well. So I can also ask her, Lucasa, to send you anything she has in English. But that is one of the purposes of ISA, is to connect people like this, so that people are sharing resources, learning from each other, adapting. That's really our purpose of being. So I'm so glad that so many have joined this call. Kerry, this is a very high number of people, participants on this call for our ISA Present. So well done you. I think it's a topic that is so interesting to people. And there's such a massive need out there. So wonderful. Yeah, fantastic. Lucas, good luck with your book. We look forward to publishing it on our website when it's done.
Thank you.
And it will be an amazing resource for African dads. Yeah, Kenya dads. It's fantastic. Great. Do we have any other questions or comments or anything else anyone would like to share? And thank you also for those of you who've joined so late. I forgot that Kenya's
Yeah.
another hour ahead of me. So yeah, it's very close to bedtime, isn't it? Thanks, Odessa. Odessa's also in Kenya, Lucas. So maybe you two can link up at some point as well. We have quite a few Kenya members actually, so that's great. So, okay, if there are no more questions, Kerry, a huge thanks to you. That was really wonderful. I think just so incredibly interesting. And thank you for being so generous, not just with your time, but also with your resources and offering to share things. It's going to be a great help, I think, to many other members. So thank you so much. And yes, we do have an Africa advocacy working group that is meeting quite soon. I don't know if you're linked into that, Lucasa, but anybody is welcome to join it who's working in Africa or based in Africa or interested in Africa. So just let me know if you want to join that or if you're not already in it. Okay,
I would
then.
love to. I would love to.
Okay, brilliant. Well, I've got your email, so I will send it to Linda, who's our board member who coordinates that group. Yeah, fantastic. Great, thank you. Wonderful. Okay, thank you everybody
Hello,
for joining,
Paula.
for all your
Hello, Paula.
contributions.
How are you?
Yeah, hi, who's that speaking?
This is Swanjala David.
That's my friend David.
Oh, hi, David. Nice to see
How are you,
you.
Paula?
It's been a
It's
while.
it's been a while. Yeah, it's quite some time now. Almost 2 years,
Yay.
right?
Yeah, exactly. May it'll be 2 years since the Align M&H conference. That's when David joined us there. We had a group of parents who came and did some wonderful work. Lovely to see you, David. Nice that you joined
It's
this.
lovely to hear from you again.
So you've got a
It's
nice
lovely.
colleague here with Lucasa on the line. So you two can
Yeah,
link
yeah.
up as well.
We're doing good. We're doing good. We actually meet and do this job together, him and I.
Ah,
He's
really?
actually, he's actually
Cool.
my leader in that.
Ah, okay. Well, you're all connected already. That is fantastic. I'm so
Yeah,
glad
now
to
to
hear.
Kerry. Kerry, thank you so much for your presentation.
Oh, thank you.
Everything this was about how you're engaging dads and how you actually assist in dealing with their mental health. This is something that is so close to my heart. There is no space actually for dads. Nobody actually cares about the dads, especially about when there is peritoneal loss. It's really a gap that has not been addressed properly. And most of these programs are actually formulated to help the moms out. So I am grateful from the bottom of my heart, and I am seeing a very, very good precedence that we can use to actually improve things in terms of matters dad's mental health. It is everything. Remember, if men come out in this and support one themselves and two support the women, the mothers, then things are going to get better every other day in terms of the stability of the family, the mental health of the family generally, and how to process these difficult moments once we go through them. Paula can tell for free that we've been really having a gap in there throughout. We will fight for the moms. We would want their mental health to improve. I have done that for quite a while, but I'm realizing dads have been left behind. So really, Lucas and I want to be a voice in that, and we look forward to keep on working with you people. Now that Lucas is going to have Kerry's email, of course, I have yours. He will still have yours. Now we can put forces together so that we make these things better. Thank you so much. I look forward to keep on working with you guys.
Thanks, David.
Absolutely. Thank you.
Yeah. Yeah, no, absolutely. You're always stronger together, right? That's a kind of, it should be our motto. But it's so true. You know, it's you can't do things on your own. You can do a lot together. Wonderful. Oh, that's a nice comment there from um, thanks, Joanne. Yes. Oh, and all your books on fathers. Wonderful. Yes. So Joanne's just saying for anyone who hasn't seen the chat that there's a chapter in all her books just on fathers. Yeah, so I actually think there are resources out there. We just, we need to get better at sharing them, don't we? and making sure that they're accessible to everyone who needs them. So yes, please do, you know, feel free to send us anything that we can put up on our website, we can share with other members, we can send out to people. Yeah, absolutely. That again is one of our aims, is to share as much as possible so that people don't have to reinvent, but they can work on stuff that's there and then adapt them to their own local situations. Hey, so we're just about at time, and I know it's very late for some of you there. So thanks again, Kerry. Thank you so much. Thank you to everybody who's joined and contributed, and for everybody who's listened. It's lovely to see such a great crowd. I wish you all then again a very good evening, what's left of it, or day for you, those of you who are in the western part of the world. And thanks again, Kerry. Big kiss to you. Thank you so much.
Thank you. Thank you to everyone. Really appreciate it. Thank you.
Right. And we'll
you,
send out the
Kerry.
recording
Good
to
night.
everybody. Judith will be sending that out shortly.
Brilliant. Thank you, Judith.
Great.
All right.
Sure.
Thank you. Good
Thanks,
night or good
everybody. Good
morning.
night.
Yeah.
Bye.
Yeah.
Thanks. Okay.